My name is Erin Gallagher, and I'm going to inform you about type 1 diabetes. You're going to hear a history of diabetes, a compare and contrast of someone who has type 1 diabetes versus someone who doesn't, symptoms and diagnosis, living with diabetes, and treatment and prevention. According to the EMDR clinician Judith Peacock from her book Diabetes, diabetes can be traced all the way back to 1500 BC in ancient Egypt, where they found manuscripts of people who had a disease where they urinated frequently. In 100 AD, Dr. Artias of Cappadocia of Greece prescribed a diet of milk, cereal, and wine to patients that were thought to have diabetes. In 1921, anyone who had diabetes up to that point usually would die, until Frederick Banting and Charles Best discovered insulin. In the 1950s, Frederick Sanger discovered the chemical structure of insulin and how it could be used in humans through pumps and injection shots. Which leads me to the compare and contrast of someone who has diabetes versus someone who doesn't for the use of insulin. For someone who doesn't have diabetes, when they take in a carbohydrate like bread or rice, the carbohydrate is then transformed into glucose via your bloodstream. Once it hits your bloodstream, the pancreas is signaled to release beta cells from the islets of Langerhans to further release a hormone called insulin to break down the glucose sugar. When you break down glucose, it helps give you energy for, say, you want to go to an OU game for the afternoon. It gives you the energy to get through, or it gives you the energy to go to the gym. For someone who has type 1 diabetes, they don't make any insulin at all, so they can't break down that sugar, so their sugar keeps rising and rising, which can lead to complications if you don't catch diabetes in time, or it can also lead to death. For the symptoms of diabetes, my friend Morgan, who is a 20-year-old college student, found that when she was 12 years old, she was extremely irritable, she had a loss of appetite, she had extreme weight loss, had extreme thirst, and would frequently urinate. Her parents took her to the doctor, and they immediately ordered to her to have a urine test. The urine test looks for presence of ketones, which feed off of fat cells for fuel instead of the sugar for fuel. Feeding off the fat cells of fuel lead to the rise in blood sugar. After she had a urine test, they ordered a blood sugar test to see how high her blood sugar really was. Once those were all confirmed, she was diagnosed with type 1 diabetes. Type 1 diabetes can be really easy to live with. You have to realize that type 1 diabetes is all genetic. There is no reason why someone gets it at a certain age. And according to the Mayo Clinic, a well-renowned clinic here in the United States, if you live a healthy lifestyle by eating a really healthy diet high in fiber with the 3 essential nutrients of fat, protein, and carbohydrates, if you don't live a sedentary lifestyle, that you are active, you can live with diabetes, you don't smoke, and you regularly check your blood glucose level, living with type 1 diabetes can be relatively easy. There is no cure for type 1 diabetes at this time, but prevention can be done with the use of injection shots or insulin pumps to help keep you regulate your blood sugar. And according to Edwin Fisher and his 5 colleagues from various universities, they are all professors in the health and science field. They found that by living a healthy lifestyle, by eating a healthy diet and not smoking, and having at least 150 minutes of physical activity a week can help prevent from having complications with type 1 diabetes. Diabetes can be a very scary thing when you're first diagnosed with it, but if you live a lifestyle that is healthy and you're regularly checking your blood glucose levels, it doesn't have to be that scary. For further information on type 1 diabetes, see www.diabetes.org.